Did you know that testosterone levels can have a profound impact on your mental well-being and on symptoms associated with things like depression and anxiety? See, testosterone is not just a sex hormone. It plays a lot of key roles in our body, and it's important not just for our physical well-being, but also for our mental well-being. And many of you might already be aware that testosterone levels tend to decline with age, and with that decline comes a variety of different symptoms, from things like low energy, loss of motivation, loss of focus, sometimes joint pain, and many others. But our mental health and our mental well-being and our cognitive function can also be affected. So when it comes to testosterone and depression, there is a link. And a couple of things to keep in mind: both depression and low testosterone have been increasing in prevalence in our society in the recent years. So in other words, we're seeing an uprise in the number of people with low testosterone, and we're seeing also an uprise in the number of people who are suffering from depression and going on medications for depression. The other thing too is there's an overlap in the symptoms. So as mentioned before, low testosterone can cause symptoms like loss of motivation and distraction, loss of energy. A lot of these symptoms are also seen in depression. So there is that overlap of the symptoms, and sometimes one can be mistaken for the other. But also there's kind of like a cycle there, because even if the low energy and loss of motivation is coming from low testosterone, that can cause you to be more depressed in a way, and having being more depressed is going to make it harder for you to do things that are going to help increase your testosterone and help you get out of there. So that's something that we can touch on a little bit later, but the main thing first we want to realize is that testosterone is key for mood regulation, and low testosterone again can cause a lot of these symptoms that look like depression, and it is associated with depression. Just a little bit more specifically, testosterone is believed to affect certain neurotransmitters like serotonin and dopamine, which are both very important for mood regulation. So dopamine, many of you might be aware, is very important for our reward and motivation drive in our brain. And also serotonin is very important for mood regulation. A lot of antidepressant medications like Zoloft, Lexapro, Prozac, if you've heard of any, they're used for depression, and what they do is they are SSRIs, which stands for selective serotonin reuptake inhibitors. So in short, they target the serotonin receptors in our brain. And these again are treatments that are used in depression. So testosterone can affect these neurotransmitters and these receptors, serotonin and dopamine, and that's just another way or another sign that kind of shows us that testosterone is very, very important for mood regulation, even though I see that to be something that's often overlooked. A lot of times people come in with symptoms of depression or anxiety and stuff, and if they have low testosterone, like, you should address that, because just addressing that can relieve a lot of the symptoms. So, and it's not only depression, there's also a link between testosterone and symptoms of anxiety as well. So again, things like focus, memory, attention, a lot of these things can be affected by low testosterone, but a lot of these things can also be symptoms of anxiety or increased anxiety. So again, if your focus, if your attention, if your memory is affected, that can present as things like brain fog, or decreased concentration, decreased motivation. And these things can, if not present as anxiety, they can obviously exacerbate symptoms of anxiety. So that again creates that vicious cycle that we've mentioned before, where it just makes it harder for you to do the right things that are going to be good for your health and good for your mental well-being, and they are going to increase your testosterone. But this is also why it is important to find ways to manage your stress and manage your anxiety, just to kind of break that vicious cycle and again start to do things that are going to help you raise your testosterone. And once you set things in motion, a lot of time, once you gain some momentum, it just becomes easier and easier to break that cycle and again turn it into a positive cycle. And when it comes to stress, many of you are also aware of cortisol or have heard of cortisol, which is a stress hormone. And there is a relationship between the cortisol levels and our testosterone levels, where chronic stress can increase the levels of cortisol in our body. That can also affect negatively the levels of testosterone in our body. So just again, it just highlights the importance of treating low testosterone when there is a problem, and just for us, especially as men, finding ways to optimize and make sure that our testosterone levels are not deficient and are not causing these negative effects on our mental well-being. So some of the things you want to keep in mind and you want to make sure that you address and that you do is, just again, be aware of what your testosterone is, where it stands, and do what you can to help optimize it and increase it so that it's not causing symptoms of depression or adding to them, And that's why also a holistic approach where you're trying to approach things from different angle can be very helpful to get a complete picture. So if you are suffering from things like depression or anxiety, and even if it's, it's not like to the point where you are on medication, or maybe you are on medication, regardless, if you know that you are suffering from some of these symptoms, a holistic approach where you are looking at ways to help manage your stress, you're looking at lifestyle changes that are going to help improve these things, and at the same time things that are going to help improve and increase your testosterone, so that way you're addressing both aspects. Because I don't think it's the best way to just maybe do, like, let's say meditation or things like to manage the stress while ignoring low testosterone, if that is also an issue. So if that is an issue, you just want to make sure that you are also optimizing for it, and you are treating it as best as you can. Because there's also been studies that have shown that testosterone treatments in people who are suffering from things like depression can many times help alleviate some of these depressive symptoms and help improve the mood and such. And that is good news in a way, because if you are somebody who has low testosterone and also is suffering from things like depression or anxiety, knowing that improving your testosterone level can improve both and can help with both is just another reason to just make sure that you are being healthy and you are taking care of your hormone and of your hormonal balances, and not just letting it drag you down. So make sure you are aware of your testosterone, know what your level is, know what you need to do to optimize it and keep it up, while at the same time doing the other, whether it's cognitive therapy or whether it's lifestyle modifications, exercising, all the other stuff too that can tackle depression, anxiety, or other mood issues that you might be having. Don't ignore testosterone, approach it in a more comprehensive way, and you'll have better results.